How do bone cancer risk factors affect your prevention? Understanding how risk factors influence bone cancer prevention can help you take smarter steps to protect your health. By knowing what increases your risk, you can work with your healthcare team to develop personalized strategies. Some risk factors are related to genetics, meaning inherited traits can make you more vulnerable. For example, mutations in specific genes like the TBXD gene in familial chordoma or TSC1 and TSC2 in tuberous sclerosis can raise the chance of developing bone tumors. If you have a family history of these conditions, genetic counseling and testing might be recommended to better understand your risk and plan appropriate monitoring. Bone diseases also play a significant role. Conditions such as Paget disease of bone cause abnormal bone growth and remodeling, which can increase the likelihood of developing tumors like osteosarcoma. Managing these underlying conditions through medical care and regular checkups can help catch any early signs of malignant changes. Previous exposure to radiation therapy is another important factor. Radiation, especially at high doses or when received at a young age, can increase the risk of developing bone cancers years later. To prevent this, healthcare providers aim to minimize unnecessary radiation exposure and ensure ongoing follow-up for those with a history of radiation treatment. Age and gender are also key considerations. Certain bone cancers tend to affect specific groups. For example, osteosarcoma and Ewing sarcoma are more common in children and young adults, while chondrosarcoma appears more often in people over 40. Being aware of these patterns can help guide screening and early detection efforts. Lifestyle choices have a big impact too. Tobacco use, excessive alcohol consumption, poor nutrition, and physical inactivity can weaken bones and impair immune function, possibly increasing cancer risk. Adopting healthy habits like quitting smoking, moderating alcohol intake, eating a balanced diet rich in calcium and vitamin D, and staying active can support bone strength and overall health. Prevention strategies tailored to these risk factors include genetic screening for those with family histories or known genetic mutations. Regular medical exams and imaging tests are vital for individuals with bone diseases or prior radiation exposure to catch early changes. Maintaining good nutrition by ensuring adequate calcium and vitamin D supports bone integrity and may help prevent fractures that could complicate cancer detection. Lifestyle modifications such as avoiding tobacco, limiting alcohol, managing stress, and getting enough restorative sleep strengthen your immune system and make your body less hospitable to cancer growth. Additionally, reducing exposure to harmful chemicals or radiation in your environment or workplace can lower your risk. In summary, understanding your personal risk factors allows you to adopt a layered approach to prevention. This includes genetic awareness, medical surveillance, healthy lifestyle choices, and environmental safety. By taking these steps, especially if you are at higher risk, you can reduce your chances of developing bone cancer or detect it early when treatment is most effective. Prevention is an ongoing process that involves staying informed, making healthy choices, and working closely with healthcare professionals to tailor strategies to your unique health profile.